Good afternoon, everyone. As introduced, I work for Toshiba Corporation, and what I'd like to do is tell you very briefly a little bit about Toshiba because it'll explain the rest of what I'm going to talk about this afternoon. Toshiba does about $60 billion in net revenue every year as a corporation. Of that, we typically reinvest somewhere between about 5 to 7% back into R&D, which for a technology company is very high. As a part of that, we constantly look at the ways to lead innovation. Some things that you typically don't see from Toshiba that you may know about is part of that innovation has been the lithium-ion batteries in concept cars, obviously flash memory and things like the iPhone, the hard disk drive within iPods, DNA chip, and several other things such as the world's fastest elevator, which currently sits in Malaysia. As a part of that, I'm involved with the healthcare system on a global basis. And really, from a healthcare perspective, we're constantly looking at how do we use medical imaging to improve patients' lives? And that's a very broad topic, but when you look at the dynamics of the healthcare system today, there is a tremendous amount of demand on imaging to provide solutions for patients. Do we do a very good job? That's debatable. At the moment, patients can spend hours and days in a medical system looking for an answer, and part of our ambition 10 years ago was to look at how can we change that model. So what if we could do that? What if we could take an exam that took days, hours, maybe even minutes, and take it right back to literally seconds and minutes? A patient walks into an ER department or a patient walks into an ED department in any hospital in the world, and we can sit down and figure out for the major disease states which are costing the system a lot in healthcare, primarily stroke and heart attack, what is actually wrong with that patient. If we could do that, we then ask the question, can we increase the quality of care while taking the cost for the health system down? There is one way to do that, and that's to take multiple exams and replace them into one singular exam that allows a patient to come into a frontline system and say, what is wrong with this patient and how many tests can I get out of one medical device to do that? This is a reality. For cardiac events in the United States, 50% of them are fatal. The first symptom that most patients have of a coronary event, unfortunately, is terminal. There is a better way we can address that. If we look at this whole organ examination, if we could look at the entire brain with one system, if we could look at the entire heart with one system, it allows us to do a very comprehensive evaluation. And this is really where the concept of Aquilion One came from. One of the main reasons for developing a thing like this, when you look at today's healthcare environment, for cardiovascular disease in the United States today, based on the 2007 figures, we spend over $432 billion addressing this with our patients today. If you look at the trends going out over the years through to 2025, this healthcare risk is only going to continue to increase, and also the healthcare cost will increase. Really, the basis for this is obviously the population around the world is both growing and aging. People's quality of care and expectations are increasing. A lot of that has to do with the advent of the internet and the access to information on a global scale. So providers around the world, whether it's insurance companies, hospitals, vendors, a major initiative is under to try to work out a way, how do we reduce these costs? And really to do this, you need a highly disruptive technology. If we keep going with the technology that we've developed in the last 20 years, we are seeing progressive increases in our ability to reduce costs, but there hasn't been any major shift that's been a quantum leap forward until the invention of Aquilion One. This is what we call the world's first dynamic volume CT. What that means is a standard CAT scanner can acquire a small part of your body, perhaps create a 3D visualization of that, but you can't see how that organ functions over time, which is one of the key parameters that we've been missing in imaging for a long time. Over this 10-year period, we invested $500 million. We created a series of test systems around the world that were tested in Japan, Europe, and finally at Johns Hopkins Hospital in early 2007. And this product was released to the world at the Royal Society of North America in November 2007. It essentially is the next major step. We've been working with a technology called multi-slice CT now for about a decade, and every year there is a major step in computer tomography technology. In '98 there was a step towards a body volume scanning. In 2008 we took that one more level into the dynamic world. And really this is the culmination of a dream for my team that we've been working on this since about 1997. So let's talk about the technology. Today, on a multi-slice CT, state-of-the-art scanner worth about $1.5 million in a hospital today, you'll see the exam on the left,